Hello, my name is Dr. Rachel Boyce and I'm one of the partners at Forest Health Group. I wanted to share this message about cervical screening, or the smear test as you might know it, because we're hoping to have more women coming in for their smear tests. There are a few reasons that some people find it difficult to have their smear test, even if they really want to. One might be embarrassment about their bodies, how they look. It might be that you find it difficult to make an appointment because of work and family commitments. Some people fear that it is painful or uncomfortable. And finally, some people have had previous bad experiences either with smear tests, or they've had bad experiences in the past not related to medical care. So this is just to reiterate that the doctors and nurses who do smear tests at Forest Health Group, we're trained to treat patients with respect and with dignity and with kindness. We know that it can be embarrassing. We know that it can be stressful. We hope ultimately that it's important enough that we can get through that, but we're always happy to discuss your concerns and worries about smear testing, especially if you're feeling very apprehensive about it. Regarding the practicalities of booking a smear test, we now can organise for you to have your smear tests done in the evenings and at weekends at Boundary House Surgery. So if you are unable to come in on a weekday, then we can arrange a weekend or evening appointment. We know that women are embarrassed about their bodies sometimes. You do not have to make any special preparations in terms of removing body hair or anything like that, although if it makes you more comfortable, please feel free to do that. And we can spend as much time as we need to make you comfortable and to minimise the embarrassment that you might feel. I hope that most of you know how important smear tests are, but it might be worth going through that again. Cervical smear screening are probably one of the biggest success stories of modern medicine. And in the years since it was formally introduced in 1988, the risk of cancer, cervical cancer, has halved. So in 1988, 2,000 women a year in the UK died of cervical cancer. Now it's just above 900. It is still the second most common cancer in women under 35, but the aim of the smear programme is to catch it before it actually becomes cancer, and that's why it works. So I hope that this has reassured you a little bit. I hope that you understand why we really want women to come in for their smear tests, and we hope you'll get to a point where you're really happy to have done it. Nobody likes having a smear test. All of the smear takers in the practice are female. We all have smear tests ourselves, and we do know that it's difficult sometimes, but I hope this has been helpful, and we look forward to hearing from you if you are overdue a smear test and you'd like to get it organised. Thank you.